Right. So, Diksha, as we were discussing about the setbacks of your you faced during your journey, moving ahead,
Hmm.
as we discussed earlier, and you mentioned that yes, there were negative thoughts in your head, and there were negative situations also there, and homesickness is also there. So, tell me, like, was there
Mhm.
you had any mantra for it, or what was your way of overcoming with all those negative thoughts and those situations?
I honestly just had like one mantra, like what my goal is, right? Like, again, goal is to be a peds emergency medicine doctor. And
Mm-hmm.
then for some reason, every time I felt like giving up, I would go back to the same statement Dr. Uncle made, that you can quit now, but 10 years later, will you be happy with your decision? And always like it, everything just comes down to that point. For me, like 10 years later, will I make regret this decision?
Mm-hmm.
And every time I think, shit, if I quit now, 10 years later, I'll definitely regret it. So I don't want to quit now. So that's been what your goal is. And coming back to the point that if you leave this, you can't come back.
Mm-hmm. So, would you still suggest your younger version to choose the same profession, the same branch, and the same journey?
I would say 1,000%,
1,000%.
always.
It's worth
The
it.
only thing I would do differently, yeah, it's 100% worth it. The only thing I think I would do differently is to have better resources. To
Mm-hmm.
have better resources to understand the process. I had no one to tell me what the process was. I learned it myself through online portals or through like asking people, and like people who are not so smart about it as well. So I think having somebody who is in the system who's able to guide you through it would have been more helpful. I
Mm-hmm.
think things would have been quicker, less stressful. But that's the only thing I would have done differently.
Right. So, if you can, just point some points, like as you are saying, कि जो आपके पास अगर better resources होते, तो better होता. Can you point down some such points?
I think for me, one of those things was like कि timeline.
Hmm.
ये जो हर चीज 1 साल पहले होती है, ये वाली टाइमलाइन मुझे पता नहीं थी.
Hmm.
तो मैं आई वाज टेकिंग माय ओन स्वीट टाइम टू डू थिंग्स इन माय फर्स्ट ईयर. दैट्स व्हाई आई हैव अ 1 year gap.
Mm-hmm.
Because I was taking my own sweet time. पहले ये करेंगे, फिर ये करेंगे, फिर ये करेंगे. And I was like, okay, looks like it's not like this. Then I figured out, oh shit, like I missed the deadline, or like, it's too close. I'm not going to be able to do my exam. Or so that time crunch, for then that pressure builds up.
Mm-hmm.
So I think understanding the timeline is very important. And there are very good resources online as well. And like, suppose जैसे अभी right now we are in 2024. अभी just match season खत्म हुआ है. So now it'll be match 2025.
Mm-hmm.
Match 2025 season begins in June, where the tokens are given out in June.
Mm-hmm.
Applications, you can start writing your application in July, August, September.
Mm-hmm.
Submit your application in September. Interviews from September to December. So ये सारी जो timeline है, this is like one of the things where I felt I would have had some kind of support would be helpful.
Mm-hmm.
Understanding what is required. What is a personal statement? A personal statement versus a CV, right? You give both those things in your application.
Mm-hmm.
Your CV is your CV. उसमें लिखा है आपने लाइफ में कहाँ पढ़ाई की है, कितने रिसर्च है, ये वो है. Your personal statement does not need to be a replication of that. That I
Mm-hmm.
was in India, I did this, and then I did that, and I learned this. No. वो
Mm-hmm.
CV में लिखा है already, right? It's already there. Personal statement is literally what it says. It's a personal statement.
Mm-hmm.
Why are you choosing pediatrics? Why are you choosing internal medicine? What drove you to do that?
Mm-hmm.
Right? Was it a patient experience? Was it a personal family life experience
Mm-hmm.
where you noticed somebody passed away and you felt like whatever it may be, but it is a personal statement. What drives you to be a physician in this particular field? I
Mm-hmm.
think having that kind of mentorship would be good. Somebody to review your personal statement is very important.
Mm-hmm.
Sometimes you think you're writing the right things
Okay.
because you know what you mean. When somebody is reading it may come across as differently. So having a third person read it, tell you, give you feedback about it. This doesn't sound right, or like this doesn't come across really well. So that is very helpful. Um, I don't know. Financially, I would say maybe if I would have had some more financial support, I wouldn't feel so crunched.
Mm-hmm.
Having maybe a loan or whatnot, like personal loans and ठीक है दे देंगे जो भी देना है.
Mm-hmm.
That is helpful. At least one thing is taken off is like traveling to the places of interview, location of interview. So that all that money is gone now. So everything is remote. So that's helpful. Remembering that interviews are very important in the US.
Mm-hmm.
Small things, that what you're wearing and how the light
Mm-hmm.
is important. If you're sitting in a room in India and light bulb ऊपर है, आपके पीछे है, if your face is dark anyway,
Yes.
like thinking about all those things. Like I had a lot of people who were interviewing with me. Thankfully, I was in the US, so I was like daylight time here. But a lot of people who were interviewing from India had like a completely dark background or like a completely dark face, not realizing that it's okay for Indian standards, but it's very different for the US standards.
Right.
All these small things, very small grammatical errors, sentence construction in your CV and your personal statement. Personal statement should not be more than 700 words, 3/4 of a page.
Okay.
We are tempted to write so much about it, but no, why would somebody want to read an essay? If it's not small, nobody's going to read it.
Right.
Even if it's about your life, nobody wants to read it, right? So remembering what catches people and what entices people to actually think about you and your life journey. And that's about it. I think like that is more of the things that I felt I would have had support in the application season would be helpful. Residency, though, you have to do it irrespective. You have no option.
No.
Once you get into it, you have to finish it. You can't crib about the hours. You can't crib about the work. You can't crib about the EMR system. You just have to do it.
Right. So, just with all this journey of yours, like, what's your message for, the undergraduates who are dreaming of this branch, or, just dreaming to practice further and in advancing, their career in USA?
Mhm. I think I think I have only like 2 or 3 advice things. Keep your goal. Decide what your goal is. Don't keep changing your goals.
Mm-hmm.
It's not an option. USMLE नहीं हुआ तो इंडिया आ जाएंगे.
Okay.
USMLE नहीं हुआ तो USMLE के लिए ही अगले साल ट्राई करेंगे.
अच्छा.
अगर आपने उसमें 1 साल की एफर्ट डाली है तो बीच में मत छोड़ो. Don't quit. Don't be a quitter. Resilience is the key. Be so resilient. Overcome every obstacle that you get. Fine. You didn't match first season. It's okay. Improve your application second season and apply again. Don't quit. I have known people who have matched after 3 or 4 years of application season.
Okay.
3 times they didn't match. Kept improving their application every year. More research, more observerships, better letters. And then matched in the 4th year and matched into good branches. Right? So not giving up, being resilient and focusing on one goal, whichever it may be. Indian PG seat or US, whatever it is. Focus on that one goal. Hurdles, nobody's life is hunky-dory. Nobody's life is easy peasy. You have to work hard. Medicine is a field where you have to work hard unless you have a lot of family money and every seat you want can be bought.
Okay.
That doesn't happen in the US. US, you can't buy seats. It's everybody's same. Yes, if your father is a big surgeon in a hospital, maybe they'll interview you. But whether they will rank you depends on how the interview goes. Right? Nobody wants a snobbish, shitty person coming to their program, even if they're the surgeon's son.
Yeah.
Right? It's going to be hard to work with them. So it doesn't matter. And remembering that you are not less than anybody else. Maybe you're different than someone. Maybe you have achieved less or more than someone, but you're not less in your mental capacity. You're still able to do it. It just requires that confidence in yourself. Don't think that you're less than somebody else. Okay, your path is different. It's fine. Everybody's path is different. Mine is different than yours. Yours is different than someone else. Someone else is different than someone else. But like owning your path. अरे यार उसकी लाइफ तो कितनी इजी है उसको तो कितने इजीली मिल गया अरे उसकी लाइफ में उसने स्ट्रगल्स देखे हैं वो थोड़ी बताता फिर रहा है क्या स्ट्रगल्स है आप अपनी लाइफ के स्ट्रगल्स पे फोकस करो कंपटीशन इज गुड बट when you have to you're working towards USMLE, competition does not matter because you are your own individual application. You're probably not going to apply in the same subspecialty as someone else, or even if you are applying, their programs criteria is going to be different.
Different.
Just focusing on you, trying not to be like I said, competitive. Be competitive to yourself. I want to be better than yesterday. I
Mm-hmm.
want to be better than what I was 5 years ago in terms of knowledge, in terms of people communication, in terms of people interaction, in terms of like my medicine. Try to be better than yourself. Compare yourself to yourself.
Mm-hmm.
I think those are the two things I would advise anyone. And if you have people in the US, like if you have relatives in the US, it's very, very helpful because, आपके आने के बाद रहने का खर्चा बच जाता है. And you have, oh, okay, if your Masi is here or whoever, right? Hey, can I stay with you while I'm doing this observership for a month?
Mm-hmm.
Right? Ideally, nobody says no if they're a loving family.
Mm-hmm.
But that helps. Like having family members here helps a lot. Um, yeah, I think that's about it. Just making sure that your timeline is right.
Right. So, I mean, आपके इस journey में throughout the journey, now I think you can answer this the best. Like, जब कोई भी एक medico है, वो ये journey choose करता है. So, when they can
Mhm.
expect, to be financially, stable. Can you just ideally just say a tentative timeline or something like that?
If you apply right after, if you apply right after medical school
Mm-hmm.
and you decide to do whatever years of residency,
Mm-hmm.
if you're going into a surgical field,
Okay.
4 साल की residency है 4 साल बाद. If you, if I would have just done pediatrics, I
Mm-hmm.
would be financially independent or like financially stable in terms of like lots of money. I still get money, but in terms of lots of money, only after 3 years of residency.
Mm-hmm.
But I chose to do fellowship because I want to do fellowship because like my goals of medicine are not to earn money,
Okay.
right? It's not to earn money. Like it's never been a goal for me. Only goal has been education and serve the people who really need them, who really need medicine.
Mm-hmm.
So that's why I'm doing this fellowship. Now, after finishing fellowship, which is in 2025 June,
Mm-hmm.
I'll get a decent pay.
Yeah.
Not like resident fellow pay, but like decent pay.
Yeah, but still, I mean, you become independent. Once you enter into the system, you get you
Yeah.
get cash. You will be like, you
Once you
can fund
start
yourself.
residency, first day you get paid. You get paid from the very first day.
Okay. So one candidate can actually expect कि ठीक है मुझे रेजिडेंसी तक का स्ट्रगल है उसके बाद I can fund myself at least.
Yes, 100%. You don't need any money. Your residency pay is enough to feed you, to pay your rent, to
Okay.
travel. It's enough.
Right. अब ये तो बात रही ठीक है about the work and about the branch and everything. Tell me one another very
Mhm.
crucial thing कि can you balance your personal life along with this journey and then after coming into entering into this branch of speciality, like can you balance it out or again I
I
mean
think residency is hard. Residency is hard because you're working almost 80 hours a week.
okay.
Right? It's very hard. Normal 9 to 5 job जो लोग करते हैं in the just saying the statement 9 to 5 is 40 hours a week.
Uh-huh.
So you're working twice as much as that.
Twice, right.
Right? You're working all, so you get one day off in a 7 day period. So
Mm-hmm.
आप Monday to Sunday, either you're working Monday to Saturday and you get Sunday off, or you're working Sunday to Friday and you get Saturday off.
Okay.
One weekend out of the year, you get a golden, out of the month, you get a golden weekend where you have both Saturday and Sunday off. It's called the golden weekend in medicine.
Okay. Right.
Yeah,
So,
you ideally are working a lot. In residency, it's hard to manage work-life balance because ऐसा लग रहा है you're constantly working. घर पे आ रहे हो, सो रहे हो, उठ रहे हो, going for rounds again. घर पे आ रहे हो, सो रहे हो, उठ रहे हो. Like, but you do have a 12-hour period off, right? If I'm working 7 to 7, a day shift in residency, then I come home at 7:30, I sleep, and then I go back in the morning. So I have 12 घंटे का off है. But उस 12 घंटे में आप क्या ही कर लोगे? आप खाना खाओगे, आप सोओगे, you'll do your laundry and everything. One thing to remember, there is no privilege when you're in residency. Your own laundry, you do your own house cleaning, you do your own dishes. सब खुद करना है, मम्मी नहीं है, maids नहीं है. Preparing yourself for that, you have to do your own cooking because if you want to like not spend all of your salary money in eating out, you have to save. And then that means you have to cook at home.
right. And during the preparation,
Fellowship. for me is great.
Okay. Yeah, yeah, please go ahead. During
Sorry.
fellowship. During fellowship? Yeah.
So fellowship is better because I have attending schedule. I work only 14 days a month and 8 hours each shift. So I
Okay.
have more time. I have great work life. I'm in Manhattan. It's the best city in the world. Going out with friends. I've made quite a few friends in the year and a half of being here. Going out with friends, enjoying new restaurants, going to Michelin star places, traveling, going for friends' weddings and things like that. Yeah. In fellowship, you have a better schedule. You're able to make more, do other things out of work. But
Mm-hmm.
honestly, I would say if you're working so hard
Mm-hmm.
to get that residency spot,
Mm-hmm.
then you should work your ass off in residency to prove that you are worth it. You are worth picking up during the interview. You should work your ass off.
Mm-hmm.
ऐसा नहीं होना चाहिए यार ये IMGs को लेना ही नहीं चाहिए काम ही नहीं करते हैं. What it does is it sets the stage for anybody who's applying after you,
Right. So you have to
right?
be
Any
sure
IMG is applying after you.
you are worth this place which you got.
Exactly.
Uh-huh.
Exactly. And that's what helps, right? Like when I graduated from residency, I started me and my other friends who were IMGs, like we were two IMGs in the program. We started like an IMG track where we encouraged our program
Mm-hmm.
to to match more IMGs, and we took the responsibility that we will train them. We will train them to be good residents, but please match IMGs. They have better experience. They are more hardworking. Please match IMGs. So
Mm-hmm.
the year after that, we matched four IMGs instead of two.
Okay.
So, how you set the stage for international graduates in the US determines how many more international graduates will come to your program.
Right. Right. That's true. So, do you
Yeah.
have any, it'll be a bitter question, but I know you as a person and you're a very, when it comes to speaking, you speak the raw thing. So, do you have actually
Hmm?
any regrets while choosing this journey of yours?
I think the only regret I feel is being away from my parents. It's hard. It's hard to be away from your parents, especially now when you know your parents are growing old, right?
Mm-hmm.
You want to be there for them. There are days like my parents got a couple of years back, my dad got a new phone and it was so hard for him to figure out back camera kaise on karte hain.
Right.
So ये छोटी छोटी चीजें, right? Like अगर मैं पापा के साइड में होती तो I would have shown him पापा ये वाली बटन है.
Hmm. Hmm.
So I think that's like I wouldn't say regret, but I think that's
You
sorrow
miss it
that
out.
I miss doing those things. अभी पापा को I want to have a doctor's appointment and then he has to like drive himself to there. If I was there, I would have done it for him. So
Right.
that's like the biggest thing. But it is a bitter pill to swallow. And I tell my parents, I message them, I miss you. And it's like, क्या करना है मिस करके हम आ रहे हैं ना 3 months में.
Hmm.
So having that communication with your family, going back and forth, taking time out, even if it's for 2 weeks,
Mm-hmm.
go home. Request your parents to come, have that connection. That helps to like, keep that motivation going. Ki yaar nahi, theek hai. My parents are okay with me being far. I have to do this for them.
Mm-hmm. Right.
And I think like not a lot of people know this. When I graduated from medical school from Russia,
Uh-huh.
my parents had come for graduation
Uh-huh.
and my dad and mom bought me a present.
Mm-hmm.
And I opened the present. It was a Littmann stethoscope. And I was like, wow, this is so nice. Thank you so much. And I picked it up and it was very, very heavy.
Mm-hmm.
And I was like, पापा ये इतना heavy क्यों है?
Hmm.
And पापा said, बेटा ये उस दिन खरीदा था जिस दिन तुम born हुई थी.
Oh.
So it was a stethoscope my father bought for me the day I was born. And he kept it with him and my mom for
Mm-hmm.
all the years till I graduated and gifted it to me on graduation day.
So they never
I still
told
don't
you
use
about
it.
you never knew about it in
No,
your childhood, or they never told you about it.
no, no, they never told me, they never pressurized me to be a doctor. And my dad gave it to me. I was like, आपको कैसे पता था? पापा बोलते मुझे पता था तू एक दिन डॉक्टर ही बनेगी. तो मैंने संभाल के रखा. I still don't use it because it's so precious. So precious. I bought a new stethoscope, but like I keep that one because it's so precious. So
Mm-hmm.
like that's what drives me.
Mm-hmm.
Right? If my parents had the confidence in me since the day I was born,
Uh-huh.
like I could have been a special child. I could have been disabled in many ways.
Mm-hmm.
But they had that confidence in me that I could do it.
Mm-hmm.
So like that keeps you going.
Mm-hmm.
Of course, I miss them, but that the fact that they had that confidence in me since the day I was born keeps me going.
True, true it is. Now, tell me one thing: who should choose this branch, or basically USMLE? I mean, it is, if we say, okay, this particular things are for such people. You need to have such quality if you're choosing USMLE, or you're choosing, this branch particularly.
I think I would say two things or three. The very topmost is to, of course, wanting to be a good doctor,
Mm-hmm.
right? Like medicine is your life.
Mm-hmm.
तुम्हें पढ़ना अच्छा लगता है, तुम्हें लोगों को ट्रीट करना अच्छा लगता है, तुम्हें that satisfaction, that humble profession, वो अच्छा लगता है, yes, then USMLE is for you. Second, USMLE is for also those people who have the attitude of not giving up.
Mm-hmm.
Of course you will cry. यार नहीं हो रहा है, नहीं हो रहा है, नहीं हो रहा है. Of course you will cry. But
Mm-hmm.
मैं give up नहीं करूँगा. That attitude, you have to have that attitude of resiliency. There will be 100,000 hurdles. There will be many, many hurdles. There will be moments where like, ठीक है यार, today I'll just drink water and sleep, or just have coffee and sleep. There will be
Mm-hmm.
many moments like that. But being okay to do that.
To do that,
Because remembering it's a phase, it's not permanent. It's not
right?
permanent. You're not going to drink coffee for the rest of your life. There will be one day when you will eat at a five-star restaurant. So
Yes.
remembering your goal.
Mm-hmm.
Not and the third thing I would say is somebody who is okay with failures.
Mm-hmm.
It's very hard. It's very hard for most people to like, नहीं हुआ इस बार, कोई बात नहीं, next time हो जाएगा.
Same हो जाएगा.
Right? There are many students, many of us who are foreign grads. There are some foreign grads who didn't clear the exam in the first time, right? The foreign medical graduate exam, people didn't clear it the first time. They
Mm-hmm.
studied hard and they cleared it the second time,
Right.
right? So be okay with failures, but learning to bounce back from them.
Right. So since you touched this topic,
I
yeah,
Mhm.
बोलो आप
I
बोलिए.
don't think if you're in the Indian medical system, you're better for USMLE, or if you're a foreign medical grad, you're better for USMLE. That doesn't matter. You're doing medicine. Both cases, you're doing medicine.
Hmm.
But the drive to do USMLE is resiliency, being okay with failures. All of those things are important.
राइट सो एज यू सेड कि ठीक है कभी कभार ऐसा होता है कि हाँ ठीक है यू हैव टू बी ओके विद जस्ट ड्रिंकिंग वाटर और हैव अ कप ऑफ कॉफी एंड स्लीप सो एक कहीं ना कहीं हर एक जो मेडिको होता है उसके दिमाग में ये रहता है कि हाँ व्हाट कैन आई
Hmm.
सम सॉर्ट ऑफ लाइफस्टाइल दे वांट टू हैव फॉर देमसेल्व्स दे वांट टू प्रोवाइड टू देयर फैमिली मेंबर्स so now you are at आपका वो एक स्टेटस पे you have achieved that status. Can you just tell, as a motivation to our young medicos that what kind of lifestyle they can expect? अगर आप यूएस में अगर जा रहे हो तो क्या लाइफस्टाइल आपको मिलता है?
Um, Lifestyle, like I said, you have to still cook clean by yourself because you're not a millionaire and you don't have home house help.
Mm-hmm.
Um, I'm a person who's not into material things, but when I started getting my salary, the first thing I bought for myself after like renting an apartment was a car. It was
Wow.
my first thing that I bought with my 100% with my own money.
Mm-hmm.
And I had dreamt of this car for the longest of time, and I bought that.
Mm-hmm.
And I felt great because ठीक I was paying mortgage. I was paying like car ka loan, how you call it, and loan ka payments. But that's okay. But it's still my own money. It's my owned car. I still have it.
Mm-hmm.
It was a red Mini Cooper. And
Wow.
it's like my brother was like, यार तूने BMW ली ये ली बोली. I was like, जाने दे BMW, मेरी ड्रीम कार, मुझे
Uh-huh.
यही चाहिए.
Uh-huh.
तो you're able to achieve what you want, but you have to pick and choose. Now, I could have also, like some of my colleagues bought a house. I could have also bought a house, but I didn't want to have roots in a certain place at that time, especially. I wanted to still explore what I want to do in medicine. But I
Mm-hmm.
felt like a car would be something that you can just drive around. If you are in one state, you can stay in one state, you can go to the other state, register the license in that state. So So I was still able, like as a resident salary, my salary was in the 60s at that time.
Mm-hmm.
I still was able to rent a great apartment, go out with my friends, buy a car, do fancy things. So status, I think, like in the US, I would say status does not come with money.
Mm-hmm.
So for example, in my residency, there is a transplant surgeon.
Mm-hmm.
He's from South India.
Mm-hmm.
He's this, he's like, I told you, the lady is the topmost top surgeon, and this
Mm-hmm.
guy is the second one. He's in his 60s.
Uh-huh.
His hand is still so strong. He drives a chota 2006, 2007 ka car. He
Okay.
wears the classic simple Indian shirt, which is not even tucked in.
Mm-hmm.
He will wear flip-flops and come to the hospital. That is nothing. But when he walks into a room, everybody stands up.
Done.
Everybody stands.
Mm-hmm.
Patients wait in line to see Dr. C. We want to meet Dr. C. We want to meet Dr. C. We want to meet. That is status.
Mm-hmm.
That is the status in medicine.
Right.
My goal ultimately, I don't tell this to a lot of people, but my goal is when I die, I should have at least one textbook in my name. That even after I've died, even 20 years later, oh, this chapter in this book written by Dr. Borker, this is what I'm referring to. So that's what the goal is. When I was in my residency, I was approached by the PG textbook of pediatrics in India.
Uh-huh.
And I wrote a chapter in PG textbook of pediatrics. It's called Cold Injuries.
Wow.
Yeah. So it in the most latest edition. So
Mm-hmm.
like when people come to you, that is status. Money is not status.
That is luxury. I
When you
mean,
walk into a room
yeah.
and 7 people stand up,
Uh,
that's status.
राइट सो लाइक या मतलब वो जो एक बात बोलते हम सुनते आ रहे हैं कि ठीक है एक बार बोर्ड्स दे लो फिर मजे ही मजे हैं एक बार ग्रेजुएशन कर लो मजे ही मजे हैं फाइनली अल्टीमेटली आफ्टर कमिंग सो फार मजे ही मजे होते हैं लाइफ में ऐसा नहीं है कि आप थ्रू आउट
होते हैं 100%.
110% मजे ही मजे होते हैं एंड यू
Yes.
एंजॉय इट
Yes.
विद रिस्पेक्ट विद लॉट ऑफ रिस्पेक्ट यस सो
Yes. 100%.
so by this, like, let me ask you another very another question, very interesting question. You have been there for like 10 years, as I think,
Yeah,
as I
10 years.
yeah, 10 years. So, are you willing to come back to India, like, हमेशा के लिए settle down होने के लिए, or you are willing to settle down over there?
So it's not that I'm not willing to come back to India, but I don't want to settle in India only because the field, the pediatric emergency field medicine is not as big in India. There
Okay.
is no program in India. There's no children's hospital in India which has a pediatric emergency department. The research is here. And
Mm-hmm.
like a big part of my medicine is research. I do a lot of research. I publish a lot of papers.
Mm-hmm.
So it's very important for me to be able to still do that and like contribute to the field of medicine. Like I said, 20 years down the line after I've died, I want people to know my name.
More, not 20 years. Let's not say that.
Or yeah, more. But like point being that that name is more important.
Right.
Like India में मैं आ जाऊंगी, I'll do a lot of clinical medicine, but the research is not as strong in India
It's not strong. Right. So along
yet.
with
Maybe
this,
there will be a couple of years later there will be.
let's hope so. Fingers crossed. Like, okay. So when we have talked about USMLE, so can you just give some advice and words for MCI candidates also?
Can you give one?
MC, some advice of yours or some message for, for the candidates who are targeting for MCI or for the foreign medical graduate examination?
Yeah. Um, I'm honestly not sure if I learned a lot in the class. I
Mhm.
definitely learned a lot from the notes.
Okay.
So if you're a self-learner, buy every note from everywhere and
Uh-huh.
just be at home and study all those notes and you'll clear the exam irrespective of needing to go to a classroom.
Okay.
Yes, I had doubts. Doubt clearing was very, very good.
Mm-hmm.
But like you had mentioned, right, initially, the atmosphere of Gautam Nagar is not a study environment.
Mm-hmm.
Of course, there's so many classes and people are like, but how many times have you noticed people sit in a small cafe and discuss questions?
Agree.
No, no, right?
Yeah.
So you can buy all the notes, sit at home and study, 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 study. You don't need to go to a class.
Mm-hmm.
If you are a classroom learner, yes, 100%. If you're
Mm-hmm.
a home study learner, get all the notes and study them at home. If you're a classroom learner, go to the classroom, but make sure you're grasping all the information that you get there. It's
Mm-hmm.
not a यार classroom जा रहे हैं लोग दोस्तों से गप्पे मार लेंगे ये वो कुछ समझा समझा नहीं समझा that's fine,
Mm-hmm.
right? uh, I think you and I have talked about this, but the pass percentage is slowly dropping because the exam is getting tougher and tougher.
Yes.
Yeah, India wants that quality of physicians, and I'm not saying that's wrong. It's the right thing, right? It's somebody's life in their hands. But like the exam is not going to get lighter. The
Okay.
exam is still going to stay tough and it'll still keep getting tough.
Yeah.
As students, we have to study more and more and more and more.
तो अपने आप को इम्प्रूव करने में
अपने
ज्यादा फोकस करना पड़ेगा, है ना?
Yeah.
So along with this, Diksha, what is your takeaway message? What students to should take this message from you from this session?
I think the only one thing, I mean, everybody's smart in their own way and they know what their capabilities are.
Mm-hmm.
But it's also important to know that it's okay to push your capabilities a little bit.
Mm-hmm.
थोड़ा सा पुश करो. 160 का गोल है, ठीक है यार, 180 का गोल बनाते हैं,
Mm-hmm.
right?
Right.
Push yourself. Don't let anybody else push you. So increasing your goals yourself and keeping one final your north star बोलते हैं ना उसको, like one direction. USMLE करना है, इंडिया पीजी सीट करना है, क्या गोल है उसी पे स्टक रहो. Don't go back and forth.
हम्म मतलब दो नाव
Just
पे सवार
stick to
नहीं
one
होना है.
goal. Work 200% towards that one goal, whatever it may be. Both goals are correct. Not one goal is better than the other. Not one goal is worse than the other. Both goals are correct. But whatever your goal is, stick to it. Failures आएंगे, fight failures, achieve better.
हम्म.
Lean on your support system. आपके parents आपका support system है, lean on them. आपके friends, आपका भाई बहन आपके support system है, lean on them.
हम्म.
Asking for support is not a sign of weakness.
हम्म.
जब आप घर में बैठ के पढ़ रहे हो, मम्मी को बोलो यार मम्मी आई एम स्टडिंग फॉर 16 hours straight, प्लीज प्लीज आप मुझे बिना मांगे चाय दे दिया करो.
हम्म.
That's your leaning on your mother,
हम्म.
right? if you're यार यार भाई मैं बहुत थक गई हूँ, प्लीज मेरे साथ वॉक पे चल ले.
हम्म.
Leaning on your sibling.
हम्म.
Leaning on your support system for other things that give you comfort so that you can study better.
Right.
फाइनेंशियली तो सपोर्ट कुछ लोग मांगते हैं कुछ लोग नहीं मांगते, बट इमोशनल सपोर्ट हमें सबको जरूरत होती है.
Yes.
Asking is not a sign of weakness. I leaned on my parents like crazy. I would call my dad, Papa, I'm feeling very tired. He would redirect me to what my goals are.
हम्म.
होता है यार ना, रोज रोज like I would study 16 hours a day. रोज रोज 16 घंटे पढ़ना is exhausting. It's very, very exhausting. So
हम्म.
you need to like have somebody to talk to. मम्मी पापा से बात कर लिए, दोस्तों से बात कर लिए, जो भी है. Find your release. Find a release that helps you.
हम्म.
And just sticking to your goals. Like that's the one thing. Studying, sticking to your goals.
Right. And anything special for the female candidates we have?
Female candidates. I think Dr. Chandra and I talked about this just now, but um, there's always this undue, unwanted pressure of marriage from the community.
Yes.
Um, it's hard. It's hard to be in the Indian system and not be married, and people are like, "अरे तुम्हारी शादी नहीं हुई." Being able to say, हाँ आंटी नहीं हुई, बस
Right.
जब करना है कर लेंगे, आपको बुला लेंगे.
Hmm.
Being able to say that in a light way and not taking it on you as pressure is very important. नहीं,
Hmm.
आंटी नहीं हुई अभी तक, आपके मन दिमाग में कोई लड़का है, turn it, twist it, do anything,
Hmm.
but don't let it bog you down.
Hmm.
Don't let it bog you down. If you find a partner who is supportive of your goals, and if you're supportive of your career, go ahead, do it. But making sure that they know what your goals and your career is. Like, आपके लिए आपका goal और career कितना matter करता है? It means being in a long distance relationship, or it means for many, it's being in a long distance marriage.
Hmm.
If if the girl matches in the US and the boy has a job in India,
Hmm.
being able to do that, keeping those expectations clear before you step into something, and
Right.
then choosing what you want at what point in your life, right? All of those things are very important. Gender bias in medicine is everywhere.
Hmm.
In the US, it's a little less than most other countries. There will be moments here that you'll walk into a room and people will be like, "Oh, are you my nurse?" And you have to say, "No, I'm your doctor and I'm going to save you today." Being
Hmm.
able to say that much confidence, right?
Hmm. Well, I don't know how to. I think one thank you won't be enough, Diksha, for you. So, I mean,
This is something I'm happy to do.
really, for FMGs, I would say one thing: whosoever is feeling, underconfident, or you're demeaning yourself कि भाई हम तो FMGs हैं, क्या होगा? See, आपके सामने एक सीनियर बैठी हुई है ना, एंड वो बोल रही है
Yeah.
कि हाँ, ये एक बार अपना जो है गोल सेट कर लो एंड स्टे फोकस टुवर्ड्स इट। पक्का मजे ही मजे हैं। ऐसा नहीं है कि आपको जो है
Yeah.
you will not enjoy your life. You will enjoy your life with luxury of lot of respect and honor. It is indeed a noble profession, and you are a doctor. No matter you are studying in India, you are studying abroad, you are going to be a doctor. What kind of doctor you're going to become, it completely depends on you, right? So
Yeah.
आपके रिक्वेस्ट से, see, I requested her and she took out her, some lot of time. I will not say some time, but she had taken out like lot of time. And she just came yesterday. She was all tired. I know she was all tired, but she was like, okay, fine, let's do it. And really,
Yeah.
Deeksha, I'm really thankful and I'm really grateful that you are my senior. I'm really proud of you. Really, I'm
Thank
telling
you.
you this from my heart after listening all this. I'm really proud of you and I'm really lucky to have you, really.
Thank you. I'm happy to help. If anybody is struggling, if you want to talk, I'm always happy to help. It's hard, but like having a support system is important. So if you're in this journey already, or if you're thinking of starting this journey and you need some form of guidance in the beginning, I'm happy to help out in whatever way I can.
Thank you so much, Diksha. We all love you. I personally love you a lot. I hope you'll
Thank
stay
you.
happy and you achieve all the dreams, whatever you have in your checklist. And we'll keep
Yeah.
meeting you as frequent as
Yes.
possible. Yes. So
Mm-hmm.
it's not a
Yeah.
goodbye, it's dasvidanya, right? As we say.
Yeah. See you soon. Yeah.
Okay, see you soon. Take care. Bye-bye.
Bye.
Bye.